Hello, everybody. Thank you for coming to our sports performance training session with Dr. Aaron Bowles. We'd like to welcome everyone. If you're a returning member, thank you for always supporting. If you're new, this is the SWAG initiative at Mount Sinai Hospital. The purpose of SWAG stands for student athlete with academic goals. We are trying to target a specific audience. We feel that athletes already have some of the skill sets that will allow them to excel in the areas of not just academic science and medicine, but also in the career of sports and medicine. And we're trying to tie them all together because if you go to practice, you have a practice mindset. If you want to achieve your goal in graduating, then you have a dedication aspect. So a lot of these variables that athletes already possess will be a great transition over to the field of science and medicine, especially teamwork and communication. So thank you for coming. I'm going to pass it to Dr. Bowles, who is ready to give you a great presentation on sports performance training. Take it over away, Dr. Bowles.
Perfect. Thank you so much, Mr. Smalls. Good afternoon, everybody. Hopefully everyone can hear me okay. Thank you for joining in today. So just a brief introduction into how this came about. I was a student athlete myself, played college basketball, but really played basketball and football all through my life growing up. And one thing I realized is that there was never a lot of emphasis on how to properly train and prepare for our sports competitions. And, you know, we were kids, we were playing AAU basketball, so we were pretty much playing sports year round. And so there was no, lectures or discussions on how to properly train your body and how to properly allow it to recover, and also how to properly prepare for training. And so a lot of health disparities that we have as minorities really not only plague, people with sedentary lifestyles that don't really get out and be as active, but they also plague former athletes. And I believe that it's because we don't really get a lot of that foundational training in regards to how to properly train and how to properly take care of your body, which also includes the nutrition part, which is honestly the most important part. And so that's kind of where this came about. I wanted to really, put something together that would help increase awareness about these issues, but also give student athletes out there and also parents out there some type of guidance into the different types of training and different types of ways to, properly hydrate and fuel your body, and how to also, prevent injuries and make sure that you're doing things the right way to be able to optimize your performance. So today we're going to get into a brief introduction into the actual sports performance part in regards to the training itself. Next week, we will discuss nutrition. And then the following week, we will discuss injury prevention and recovery. Today, we'll be discussing resistance training, mobility and plyometrics, training schedule optimization, and as well as different training zones. So let's get started. All right, so resistance training. So here are the objectives. We'll discuss the different types of contractions that occur when resistance training, also different types of resistance training, and then we'll get into the benefits. Essentially, I did a literature review out there of a lot of different studies and also meta-analysis, which are basically just studies that compile a bunch of other studies and try to find if there's, significant correlations with whichever variables that they're looking at. So in a lot of the studies I looked at, it was athletic performance and the relationship or correlation with resistance training. And primarily I looked at kids and adolescents, but a lot of these things also apply to adults as well. So in regards to contractions, basically there's three different types of contractions. The contraction itself is defined as muscle fibers working together to generate tension. And this tension allows us to be able to control the amount of weight that we're using. And so there's isotonic, which is essentially a constant tension. If you look at the word, so iso meaning like isolated or alone, and then tonic is going to be here tone or tension. And so this tension stays the same as the length of the muscle changes. So you can imagine if you look over to the diagram on the right, if you look at a concentric contraction, that would be synonymous with lifting a weight or curling like a dumbbell. And so as you do that, the muscle is shortening under the constant tension of that dumbbell. So that dumbbell may be 5 pounds or 10 pounds, but basically that the tension that that dumbbell is applying does not change. The only thing that's changing is the length of the muscle. So concentric is shortening of the muscle. Eccentric is lengthening of the muscle under constant tension, which would be similar to the diagram on the right at the bottom, where that would be like trying to lie a dumbbell down on the ground or put it back onto the rack. Isometric exercises is a force generated without changing the length of the muscle. So an example would be a lot of body weight exercises, such as planks, as you see down here to the left, where the gentleman is kind of holding himself up in a plank position. So here, the tension is the force that he's generating is changing the tension, but the length of the muscle is going to be constant here because he's just staying in one place. He's not going up and down or side to side. Same thing with the young lady to the right of him who's performing what's called a wall sit, which focuses on the glutes and the quadriceps. And basically she's holding herself up. So the length of the muscle isn't changing, but the tension of which the muscle or the force is generating is changing as she continues to hold. So whenever you're performing exercises, you're actually performing a combination of these contractions. So you can imagine if you were doing a bicep curl, part of that is going to be the concentric aspect, which would be raising the weight up, and then the eccentric part would be lowering the weight back down to its starting position. And so it's important to give emphasis to both the concentric and the eccentric as well, and also be able to combine isometric exercises into a workout plan as well. And anyone, this is very like informal, so feel free to stop me at any time if you have any questions or comments, or you can wait till the end. It's up to you. So regards to different types of resistance training, two of the popular or most popular resistant bands and also free weights. So resistant band is basically an elastic band. Typically they're color coded based on the amount of resistance that they can apply. So for instance, and also the thickness of the band typically will correspond to more resistance. And usually the different types of bands you'll see are like these loop bands, which are the ones at the top that the lady is using, or you can see what's called compact bands, or the ones that have the handles on them in the middle on the diagram to the right. And then the bottom are what we call therapy bands, which are typically like these kind of mini loop bands. And those are good. Usually you see a lot of women use those for like lower body exercises, the mini loop bands, or people use a combination of all three. And typically these bands will come with different attachments to them. So you can, have like a ankle attachment or wrist attachment. So you're able to do different types of exercises. They also will come with like a wall anchor or a door anchor rather, that you can use in home. So, a good perk to the resistant bands is that it's very convenient. A lot of times you can create good workouts in your home, just using the door anchors and being able to stand on the band and do exercises, or loop it around, the bottom of your bed, or different things that are strong enough to hold it. And then also you have free weights. So this would be, like dumbbells or kettlebells or a barbell, or also a medicine ball, or standard and a Olympic weight plate. So Olympic weight plates typically have different colors that correspond to the weight as well. So some of the benefits. So there's actually tons of benefits of not only resistant training, but just overall, increasing your physical activity. There's positive effects on your health, uh, both short term and long term. Psychosocial skills. So, a lot of kids will get into sports early on just to be able to build their social skills and be able to, work as a team and meet new kids and meet new people. And then also the positive effects on sports performance, such as balance, muscular strength, and power. And then also the reduction in severity and incidence of injuries as well. And, another thing I was always taught growing up is that there was this kind of a stigma against lifting weights, too early because of stunning your growth. Actually, studies show that there's no direct correlation between resistance training in a young age and growth stunning. But it's important to mention that, the growth plate is basically a thin layer of cartilage that's at the end of your long bone, so like at the end of the femur, as well as the articulation points at the tibia. And so you can imagine if you're training improperly, or your training is too intense and it's not structured, you can risk injuries to your growth plate. So the correlation with growth stunning would be secondary to you damaging your growth plate, which would be secondary to you training improperly. But there's no direct correlation with the resistance training itself, and stunning of the growth or damage to the growth plate. So that's important to note because, a lot of coaches and parents are kind of under the impression that kids shouldn't start any type of resistance training until, sometimes even up until like teenage years, which is not the case. So there was this study titled "The Effects of Resistance Training in Youth Athletes on Muscular Fitness and Athletic Performance." And so this was a diagram that I pulled from it that pretty much breaks down the chronological age and also the types of training that is appropriate for that specific age. So just kind of following it from left to right, it goes early childhood into late childhood, adolescence, and then adulthood. And then if you look at the very bottom, you can see some of the different aspects of training that should be incorporated at that point of life. So if you look early on as a child, ages 6 to 9, you want to focus more on coordination, agility, and balance. These are some of the motor skills that are developed a little bit later in life. So it's important to focus on developing those or finding supplemental ways to develop those early on. Also muscular endurance training with your own body mass. So if you see there, it doesn't really incorporate free weights yet in that early childhood stage, but that doesn't mean that you can't still resistant train by using some of these other techniques. Then if you move into late childhood, which is essentially ages 9 to 13, if you include both male and female, you see that now you're starting to incorporate free weight training, some core strength training, some plyometric training, which we'll get into a little bit later. And then so on as you move into adolescence and adulthood, you can see that the training gets a little bit more specific and a little bit more intense. But there's nothing to, there's no evidence showing that there's detrimental effects of adding some of these other more intense activities, around the late childhood stage. But once again, it just needs to be in a structured way, and also in order to prevent injuries. All right, so now we'll get into the mobility and plyometrics. We'll talk about some of the definitions and benefits and also some techniques that can be used when performing the mobility exercises as well as plyometric training. So mobility and flexibility, they're very common terms, and actually some people use them interchangeably, but they're really different, two different concepts. So flexibility is referring to the ability to move a joint through a certain range of motion. And then mobility is the functional motion without any range of motion restrictions. So basically flexibility is the foundation of mobility. In terms, if think about doing a squat, a person who's more flexible, like in the hip joints and also in the knee joints, is going to be able to get to a lower depth on that squat, which that lower depth in the squat is the mobility part. So that, mobility part is basically depending on how much flexibility that you have. And so the relationship between mobility, flexibility, and also sports performance is sport specific, which is also a very important thing to mention, because if you take a football player and someone who, say, is a gymnast, the gymnast is going to rely a lot more on flexibility and mobility just based on the types of activities and movements that they're performing. However, a football player, you want to have a good amount of flexibility, but you don't want your joints to be too mobile, because you're doing a lot of stopping on the, on the dime, and cutting and twisting and turning. And you can actually have too much flexibility, which can be detrimental, or put you at risk for injuries. So, it is important that training is really sport specific, because that's going to dictate what type of training program that, you'll be focusing on, and also what types of things you would want to be able to emphasize in order to optimize the performance of that specific sport. So some of the benefits of mobility, of increasing mobility and flexibility. So your strength, power, speed, and endurance, all of these require sufficient range of motion for optimization. And so also this good balance between flexibility and strength will help you promote good posture. And this is even more important nowadays, because everyone is kind of working from, well, not everyone, but a lot of people are working from home. And so they tend to kind of sit all day and be hunched over at a computer. And so being able to focus on not just like the strength training part, but also their flexibility is going to help them moving forward in terms of promoting good posture and preventing some of the injuries that are associated with bad posture. And so this is one thing that we mentioned earlier in regards to the decreasing the risk of injury, and how I mentioned that too much flexibility can be detrimental. So in terms of the techniques, you really, I tell people this all the time, you should really stretch or do some form of stretching every day. And so this emphasizes it here that mobility exercises should be done daily. And the focus should really be on all joints. If you look at some of these exercises that they're performing here, you're stretching the wrist joints, some of the joints in the fingers, in the ankle, the knee joints, the hips, even the elbow joints. So you really, just with these 6 movements here, you've really covered a lot of the major joints in the body. And it's important that you focus on those joints that you're actually going to be using to exercise. For instance, if I know I'm going to be doing a lot of forearm training, I would want to make sure I'm focusing on getting some good stretches done to my wrist prior to me training that portion of my body, to prevent any types of injuries, and also to optimize my workout as well. And so the focus should be on all joints. Usually about 5 to 10 exercises can cover this. And you really want to focus on deep breathing, not only during mobility exercises, but also during any type of exercising. Breathing is extremely important. It helps with increasing circulation, relaxing muscles, and also decreasing lactic acid buildup. With plyometrics, so this is a little different than just the normal or typical resistant training. So this usually focuses more on producing power. And power is really a combination of strength and speed. So, if you were to kind of take an example of differentiating those two, say someone was doing a push-up, being able to do the push-up is strength, but being able to, do more push-ups than somebody else in, say, a 30-second time frame would be more power. So they're able to explode and get through those movements a lot faster than someone else. That would indicate that they have more power than them, not necessarily more strength. And so plyometrics focuses really on power and explosiveness. And so, as I mentioned earlier, this is important because depending on what type of athlete you are, or what type of sport you play, you may focus more on plyometric training than someone else may. So for instance, say you were, a tennis player versus a long jumper, or versus even a football player. Football players, long jumpers, you really want to have as much power because you want to be able to produce forceful movements in a quick amount of time. And so, it's important that you would incorporate some of these things where you're really doing a lot of jumping. That's why it's often referred to as jump training into your workouts, to really produce more explosiveness. And so, and also with agility as well. And so some of the examples are, to the right, you have these box jumps or squat jumps, single leg hops. And for upper body, like I mentioned before, the push-ups, so like a clapping push-up would be a plyometric exercise where you're really having to explode up with enough force to be able to, suspend yourself in the air for enough time to clap and then get your hands back down to prevent yourself from, smashing your head into the floor. So this is another example of a plyometric exercise that a lot of people wouldn't really consider plyometric. Oftentimes people jump straight to, the jump training as plyometrics. So, having a very diverse, training schedule, I think is important, especially early on, and being able to really cater it to whatever sport that, the person is playing. All right, so get into the different training zones. This is another thing that I just recently, maybe about a year or two ago, really started to understand. And when you're training, and this is really for endurance purposes. So people that are, say, marathon runners or cyclists or swimmers, they really rely a lot on aerobic and anaerobic capacity. So when you're training, you want to have a structured way of training. And so you can do that based on these different zones that correspond with the percentage of your maximum heart rate. So just an estimate of maximum heart rate, it's not a precise number, but usually you can do 220 minus how old you are. So say you were 20, your maximum heart rate would be 200. And then you would then go over to your the zone chart, and you would say, okay, if I wanted to be in zone 2, I know I need to be at about 65 to 75% of my maximum heart rate. And you use this quick equation to get your maximum heart rate, and then you can do 65 to 75% of that, and exactly where you are in that zone when you're training. And it's more structured. It's going to optimize performance and also prevent injuries. It's going to prevent you from burning out prior to having to perform. And so these different zones are used. Zone 1 is more of a recovery zone. So say you had a very intense, swim meet the day before, but the following day, you don't want to just sit in bed and not do anything. You want to still do a light workout. You would do more of a recovery zone. So this would be at less than 65% of your maximum heart rate. And these are typically better for after competitions or intense activities. So for myself, I'm really big into cycling. And so I focus a lot on my zone training. And so I, typically have a heart monitor strapped to my chest when I'm cycling. And I have a computer monitor that's attached to my bike that's basically telling me what my heart rate is. So I know if I cycled 60 miles and had an intense session the day before, and I want to stay more in a zone 1, I can see what my heart rate is at all times, and I know exactly where my target is. So my training is a lot more structured. So for zone 2, this is basically a minimum intensity required to cause endurance training adaptation. So basically, you're starting to train your body to be able to hold these higher heart rates for longer periods of time. And they call this a conversation pace. When I'm in a zone 2, I should be able, like, say I'm cycling or jogging beside a friend, I should be able to have a conversation with that person as we jog. I'm not exerting myself too much to where I can't speak in full sentences. Zone 3 is usually longer sets of intervals. And usually the adaptations that are in zone 2, you typically see through zone 3. And a lot of these adaptations are basically increasing our body's ability to utilize oxygen, which is going to help you in terms of endurance. And so a zone 4 is going to be just below your what's called an anaerobic threshold, which is the lowest intensity of exercise at which your body's production of lactic acid exceeds its ability to utilize it. So basically, too much lactic acid is building up. It's exceeding my body's ability to use that. And so it just continues to build up and build up. And so, especially if you're an athlete, you're out there and you've ever been training, no matter if it's running suicides or sprints or whatever, you start feeling that burn in whatever muscle group that you're working. That's that lactic acid building up. And so, it's important to be able to understand that these different zones, you're going to either be below, at, or above that threshold to where that lactic acid is building up. But being able to train at these different zones will increase your ability or increase your anaerobic threshold. So for instance, if my training is more structured than someone else's, I know which zones I'm in, and I can sit and I'm preparing myself, then it will take me longer for that lactic acid buildup to occur to where I really feel a burn than it would take that person. And so, that kind of goes back to how essential it is to really know how I'm training. You're really training with a purpose. And so zone 5, you're at or slightly above your anaerobic threshold. And this interval, this is usually done in 2 ways. You can do like interval training where you really go hard for a short amount of time, and then you have a recovery phase. So you may go really, really hard for like 5 minutes, and then you'll have like 2 to 3 minutes of just very light, like zone 1 recovery. And then you would keep doing that and maybe do 3 to 4 sets of that. And zone 6 is very similar, except you're typically at greater than 90% of your maximum heart rate. And then when you recover, you're going to drop back into like a zone 1, which is typically around 60 to 70% of your maximum heart rate. So I guess to kind of sum all that up, basically you're training your body or conditioning your body to be able to go longer and produce the same amount of power without exceeding your anaerobic threshold. So you're training your body to be able to function more optimally. And this can also be what's called, they use a scale called rate of perceived exertion, or RPE. And this chart, that's essentially a subjective measure of how intense you're currently training, or self-regulation of training intensity. So you can do this based on, your breathing, for instance. So if you look here, you have the RPE to the far left of this diagram, which is the rate of perceived exertion. So perceived meaning, how do you feel? And you can see that they have in this diagram, it corresponds with the training zones that we discussed in the previous slide. And so at a 0 or 1, which would be a zone 1 training zone, you're breathing, you're not really exerting, you're very, you're lightly breathing, just like normally. And so in the percentage of your maximum heart rate at this time is around 50 to 60%. This would be considered like a warm-up type of exercise. And then you can, if you look down, like for instance, into a rate of perceived exertion or modified RPE, if you look at around like a 4 or a 5, then you're getting towards that anaerobic threshold. So you're at about 70 to 80%. And then when you switch to zone 4, you see that on exercise type to the far right, you go from aerobic to anaerobic. So now you're at that threshold. And at that point, you're starting to breathe really hard, and it's getting a little uncomfortable to breathe. And then you get into like a zone 5, it's like, I'll tell this story. Sometimes cycling, certain people I don't like to cycle with because they want to always talk and have like a conversation. And I'm like just trying to breathe, and I'm dying, and I can't, talk. So that would be, I know when I'm like that, I'm more in that zone 5, zone 4, zone 5, just based on, how I feel. So that's really a way that you can use these different scales to really monitor how your training is, and whether you're in more of a recovery training day or more of a, intense training day. And VO2 max is basically your body's ability to utilize oxygen. And so the way you measure that, it has to kind of be done like in a lab. So basically they'll hook you up to these different monitors. They'll incrementally increase the exertion. So say they put you on a treadmill, then they'll slowly bump up how fast the treadmill is going. And then they're looking at your oxygen consumption. And once it gets to a point where it's steady, and no matter how high that treadmill or how fast that treadmill is going and how intense you're going, your oxygen consumption is not increasing. At that point, you're at your VO2 max. And so all these metrics are ways to really, increasing these is gonna help you be able to go harder for longer. All right. So getting to some of the like training schedule. So there's no single like optimal training plan or schedule that would fit everyone. Like there's no like one size fits all, because there's so many different factors that determine an athlete's optimal training schedule. So as we mentioned before, the type of sport that they're playing, also what type of fitness goals do they have? Are they more of a long runner or a marathon runner? Are they a sprinter? You know, are they someone who's a linebacker on the football field who needs more power? Are they focused more on just core strength? You know, what are their body composition goals? Do they want to put on a lot of muscle mass and bulk up, or do they want to decrease their body fat percentage and shred and have those like abdominal muscles start popping out? You know, that will also dictate what type of training schedule they have. If they have any pre-existing conditions. So, you know, if someone has, you know, heart issues, or, you know, they're recovering from COVID, you know, that type of person is going to have a different training schedule than someone who's preparing for a boxing match or for a swim meet, you know. Or if someone has, say, a disc herniation, you know, you're going to want to stay away from certain exercises that require a lot of bending and putting increased stress on the areas of where they have deficits. And then obviously, if they have injuries, that's also going to affect their schedule as well. So where do you kind of start with all this? You know, say you're 12 or 13 and you're like, I want to get into, you know, working out and training. Usually you want to start with about 1 to 2 sets of 8 to 15 reps. And this, you want to be like light to moderate load. So about 30 to 60% of your rep max. Rep max is basically like, say you were doing a bench press. How, you know, what amount of weight can you put on the barbell to where you can only put it up one time? That's your rep max. And so when you're doing light to moderate, you want to be at about 30 to 60% of that. So say your rep max, say I can only bench press 100 pounds one time. If I was going to train at a light load, I would be at about 30, I would use about 30 pounds, because that would be around 30, you know, 30% of my rep max. And then, you know, as we got into earlier, what also dictates it is if, you know, what my body composition goals are. If I want to bulk, typically you'll see like football players, you know, they want to be bulk, you know, have a lot of muscle mass. So you tend to see them lift really, really heavy. So they would be more at like a moderate to high load. So maybe like around 60 to 75 or 80% of their rep max, but they'll do smaller or lower number of reps. So for instance, that person might do, you know, 2 sets of 8, but they're going to be at about 75 or 80% of their rep max. You know, someone that just really wants to kind of lean up and kind of shred, you know, and just tone, that person is going to do more reps, but at lower weight. Okay. So that person may do 12 reps at about 50% of their rep max. And then usually you perform about 8 to 12 exercises, and it depends on how you split it up. But typically you see people train different body groups on different days. So for instance, you know, on a Monday, you may train your back, you may do back and biceps. And then on Tuesdays, you may take off. Wednesday, you might do your chest and your triceps. And then Thursday, you may take off. Friday, you might do a leg day, you know, or, you know, that's kind of how you want to structure it, but you want to have about 8 to 12 exercises on each one of those days so that you're able to adequately target those muscle groups. Also, the training frequency, especially starting out, you want to have, you know, at least 2 non-consecutive days per week. And as I mentioned before, this frequency and intensity can increase or decrease depending on the experience that you have and also whatever your goals are. And so there was an article published in the British Journal of Sports Medicine, which used a meta-analysis to evaluate the effects of resistance training in athletes aged 6 to 18. And this analysis showed that there are moderate effects of resistance training on muscle strength and vertical jump performance, and small effects on linear sprint, agility, and sport-specific performance. So this is one of those, you know, situations where you're really targeting your training towards a specific thing. So someone who's, you know, wanting to just have strength and vertical jump performance, not necessarily rely a lot on power, you know, resistance training is definitely something that they could do in isolation. But if you're looking more for like that power, so if, like a linear sprint, like you think of a sprint, you want to take off fast and try to maintain that fast speed and finish strong, or agility, all of these are more geared around power. And so, as we mentioned in the previous slides, you would want to focus more on plyometric exercises. So this study, I wanted to show it because it really shows how, having a diverse training schedule or training regimen where you're incorporating different types of resistance training, as well as focusing on the flexibility, your mobility, but also your plyometric training, is really going to optimize your performance. And so they also looked at the a dose response relationship to be able to see what is the optimal amount of time for training, and also rep sets. So this showed that a training period of greater than 23 weeks with about five sets per 5 sets or exercises per session, 6 to 8 reps per set, and a training intensity of about 80 to 90% of the one maximum rep, with 3 to 4 minute rest between the sets, was the most effective in regards to increasing performance overall. Okay, getting towards the end here. So definitely want to emphasize core training. So your core muscles, they work to stabilize your body, whether you're standing or sitting. A very important foundation of power and balance. And oftentimes, you see patients come in, we get them at our sports medicine clinic all the time. I would say low back pain is probably the most common complaint in any type of musculoskeletal clinic setting. And so a lot of this is secondary to weak core muscles, poor posture. And it's important to note that when you think of core muscles, it's not just your abs, and your ab muscles in the front. You're also, that incorporates your oblique muscles on the side, and even the back. If you look at the multifidus and your erector spinae, these are very deep back muscles. So you can imagine, if I have a weak core, if my deep back muscles are part of my core, I'm probably going to have issues with my back. And so if you look at the picture at the bottom, that's the psoas muscle. And so that's, kind of here crossing through the hip girdle. And so that's also important core muscle as well. So a lot of these muscles are really deep. And so, it's important that you understand where these muscles are, because when you're doing certain exercises, you need to know where the muscle is in order to be able to target it. And so also when training the core, it's important to include variety of different complex movements in your core training. And so, for instance, using the resistant bands, and also I ran across many studies that showed increased performance when adding resistant bands to free weights. So for instance, if you were going to do like a deadlift, for instance, where you're basically holding the dumbbells to the side of your body and you're just keeping your legs straight and just leaning straight down and trying to drop that weight down to where your foot is, and you're focusing on your low back and also your hamstrings in that workout. But if you can imagine having an elastic band, wrapped around your stomach and stretching out as far as you can to where you feel like that band is trying to pull you back, and then performing that same exercise that I just mentioned, you can just imagine having to really like tighten up your core and your stomach area in order to keep yourself from coming back, but also to be able to perform the exercise. So this is an example of, adding the variety of these different complex movements, not just doing like a sit up, or crunches or planks. You really want to focus on targeting different areas of your core. All right. So in summary, resistance training is a safe way to improve athletic performance. It's been shown to improve overall health, also improve psychosocial skills. Also ran into some studies that showed an increase in what's called IL-6. I'm not going to go into a lot of details about that, but basically it's called interleukin-6, and it's a substance that is secreted by the body for a pro-inflammation stage. So basically, it has a protective factor against inflammation. And so this actually leads to protective cardiovascular effects. So they had these patients that had very high risk factors for cardiovascular issues, like they had hypertension, high cholesterol, atherosclerosis. And so these patients, after being put through resistance training programs for 8 to 12 weeks, showed an increase in this levels of IL-6, and also which they correlated with protective cardiovascular or heart effects. Also, the studies have been shown to have academic benefits to physical activity, including resistance training. So there's a University of British Columbia study that showed an increase in hippocampus size in this area of the brain, which you see to the top far right. And the diagram is responsible for verbal memory. And so, there were studies that, and you can look these studies up on like PubMed or something, the relationship between physical activity and academic performance, but it basically showed the ability to retain information in form of memory was increased in students who had exercised prior to those sessions where they were asked to recall certain things that they were showed. And so, all in all, personalized and structured training is very essential in order to be able to utilize the benefits of resistance training. And just have to keep in mind that in order for this to be performed safely, there does need to be structure. And so, it goes back to, this is really the point of this, is to increase some awareness of some of these different ways that you can optimize your performance, but also optimize your health. This isn't just geared towards young student athletes. These are things that, I myself incorporate into my daily activity. And, people that are in their 70s and 80s that have a very high quality of life tend to be really active. And so, it's one of those things, if you don't use it, you lose it. And so it's important to really understand at an early age, how do I really take care of my body the right way? This includes my physical activity, but also includes what I put in my body, which we'll touch on next week in regards to the nutrition part. So at this time, I'll take any questions and comments. I really appreciate your time, your attention. I hope you're able to, gain something or take something away from this discussion.
Thank you, Dr. Bowles. That was a great presentation. I wanted to say, I think I learned a lot, especially when it comes to training. As a former athlete in high school and college, I haven't played basketball in a long time, but definitely the whole stretching aspect is something that I need to get back to. We had our first question in the chat. I believe that was from Dr. Miller. If Dr. Miller can unmute and ask his question directly.
Yes, hi. The question was, why can't athletes train at full intensity at every workout?
So doing that, you can increase risk of injury, because when you're working out, you're really breaking down the muscle in order to cause it to build itself back up in what we call hypertrophy, or get that mass effect. And so if you're not giving the muscle time to recover, you're just loading it with forceful, intense activity, then you're increasing your risk of injury. And also, no matter how hard you train, if you can go as hard as you want, but your performance is going to decrease. Like if I try to go, try to cycle and be in a zone 5 every day of the week, I'm going to notice that my speeds are going to go down, because there's no way that your body's going to be able to sustain that. And all you're doing is just, predisposing yourself to injuries. So that's why it's really important to kind of fluctuate your zones or intensity of training to prevent that. Give your body time to recover.
Okay, I had a question that I'm posting in the chat. Does back pain connect to being like slightly overweight or anything like that, or does it attribute to having a weak core?
Yeah, it actually both, because a lot of times people that are overweight, they have a weak core. And so that's all really connected. And often, and also if you just think about it anatomically, if someone has a lot of like fat, like in the central portion, like in their abdomen, it usually, the direction that it goes is forward. So a lot of times that weight will actually pull your posture more forward into even more of like a hunched over position. And so it takes you having, strong core muscles to kind of be able to sit upright with your chest up and be able to maintain that posture. So a lot of people that are obese have a hard time doing that. And so
does anybody else have any questions that they would like to come off mute and ask? If you like to come off camera, that would be great.
And I really just encourage everyone, get up, get active, get you a routine, find something that works for you, because it's very important. You know, a lot of the health disparities that, like I mentioned, plague us as minorities, you know, they can be prevented if we just kind of get more active and make sure we're eating the right things and, you know, focusing on what we're doing and what we're putting into our body. You know, even like your insulin sensitivity and the way your body's able to metabolize glucose, um, you know, your blood circulation, all of these things are affected by not only what you put in your body, but how active you are. And so all these beneficially health effects that are out there, you know, are everything is scientifically proven. It's all evidence-based medicine, you know, showing the effects that these things have. And, you know, me being being a rehab doctor myself, you know, we see this. We see patients that were in the hospital for the last 3 months, you know, after having COVID, and they've basically sat in a hospital bed, and now their muscles have atrophied and they've gotten smaller. Their muscle mass is low. They're very malnourished and weak. You know, once you get these patients into acute rehab and you get them up moving and get them strength training and focusing on balance and walking and going up and down stairs and all these different things, you know, that's what gets that patient home safe. And so, you know, we really see these things every day, you know, and being able to also see the impact that it has on people that already kind of have healthy lifestyles, but you want to be able to maintain that once you get older. A lot of times, if you play a sport, once you quit playing that sport, a lot of things that were associated with playing that sport, such as waking up 6 a.m. and going to work out or going to practice twice a day or having games on the weekends, all those things are gone too. So if you're not supplementing that time with physical activity or doing things that are more sedentary, you know, you end up falling into that category of being at increased risk of diabetes, high blood pressure, high cholesterol, you know, kidney disease, all these different variety of ailments.
Dr. Bowles, can you stop the screen sharing? I wanted to ask a question since we don't have any other questions right now. When you showed the resistance bands, I was curious to know, is there a difference between resistance band weights and natural body weight, and which one is more effective for the athlete when it comes to training?
So it all depends. You know, weights, if you're really, like, say you're a football player and you're really trying to bulk up and put on a lot of mass, then a lot of times that can be achieved quicker through free weights. Um, and then, you know, if you're trying to just kind of tone up but still maintain that strength, then you would want to, you know, do more maybe resistant bands or free weights, but at using low weights with higher reps. But really combining the two is the way to optimize your performance and get the best results. Because when you combine the two, that's when you end up targeting your core just by default. You know, so and then using your body weight, you get more into like plyometrics and things like that. So, you know, depending on what you're training for, you would incorporate, like me right now, like I being cycling and getting into competitive cycling, I really focus a lot on power. Power is my ability, you know, to put a lot of force into those pedals, but do that at a fast rate and be able to maintain that. So when I work out, I focus on, you know, resistant band training. I also focus on weight training, but also plyometrics and a lot of body weight stuff as well. So, you know, it's very, like we said, sport specific, age specific. Like, say, you know, 8-year-old or 9-year-old, I'm not going to have them on free weights. I would refer back to that chart and maybe start them on doing more like mobility training and like some resistant band training, you know, really teaching them the technique and the form, teaching them how to breathe properly while they're working out, you know, all those different things, having them doing a lot of body weight stuff, push-ups, sit-ups, you know, box jumps, squat jumps, those types of things you would want to do a little bit early on and not jump into the free weight. So it also depends on who you're training, you know, their demographics, their age. Also, you know, if you've had back surgery, you probably don't want to be doing too many explosive plyometric type of exercises if you're, you know, rehabbing from that. So that's the thing, man. It's very, exercising, even nutrition, they're very personalized topics. It's not a one size fits all. It really depends on what your goals are, where you are, what your body composition is, and what you're looking to achieve. And it's the same thing with the nutrition part. I can't just give everyone, a diet plan and say, here, take, there's different, macronutrients and micronutrient percentages that you may need that I don't, or vice versa. So, and we'll touch on that next week, but just an example that it's something that you kind of do on a case-by-case basis, depending on where your focus is.
Okay. Dr. Miller, you have a question?
Okay. Well, just a general question. This is a good session. I just wonder, for those who couldn't make it today, or for people who want to go back and listen to something that they heard today, will this session be available for future viewing and listening?
Yes, we're currently recording this session, and I put in the chat this SWAG website. We're currently working on putting all of our material on the SWAG website. So all of our recorded sessions will be up on the website as soon as IT can update the sections. So they will be available. And if anybody wants the link to view online, so Zoom has the cloud version where it records and it provides a viewable link. If anybody needs that link, please email me. Put my email in the chat, and I will email you a viewable link.
So Dr. Bowles, you mentioned that when someone is hospitalized and they're bedridden, how they lose body condition. Can you talk just briefly about that phenomenon where you are exercising on a regular basis? It seems like it takes a lot, you lose condition a lot faster than you gain condition. Can you talk about that phenomenon?
Yeah, definitely. I feel like that's how life works in general too. I mean, you could spend your whole life chasing a dream and you finally get it, and it only takes you a second to blow it all. So it's very, very similar with the body composition. So it's really the use it or lose it phenomenon with that. These patients going to the hospital. When you're at home, you're up, moving around, you're getting up, you're going to the you're going to the mailbox, or you're going to the refrigerator, you're getting in and out of the shower, you're doing all these things that once you're hospitalized, you're no longer doing. You're just really in a bed, or maybe sitting in a chair beside at the bedside. And so you're no longer using these muscles that you're used to using. And so these muscles just start to atrophy. They do the opposite of what happens when we work out. And over time, these patients just become very deconditioned. And this is not necessarily just a musculoskeletal phenomenon too. It also affects, their overall respiratory drive. So a lot, especially these post-COVID patients, so not only are they, having issues with the muscular component, but their breathing component is affected as well. And so, and I don't know necessarily the science behind why it takes, it's like quick to lose it, but hard to kind of get it back. Like if you're in a good rhythm, I always think back to the example of eating. So basically, if you want to lose weight, you pretty much eat less than what you eat less than what you get out, right? So if you're burning, say you should be eating 2,000 calories a day to maintain where you are right now. If you wanted to lose weight, then you need to do less than your maintenance, which would be less than 2,000. So say you would do a 1,500 calorie diet, right? Now, say you do that 1,500 calories every day, right? You're at 1,500 calories. So every day I'm 500 calories lower than my maintenance, right? Say you do that for 5 days, or just say 4 days and make the numbers even. You're 500, right? So you're saying that's 2,000. So now I'm in a 2,000 calorie deficit, because each day, those 4 days, I consumed 500 calories less than what I really needed to. So now I'm in a 2,000 calorie deficit, right? Now say that next day on Saturday or Friday, I go eat, I go out to eat at a restaurant. I ate my normal amount of food that day, but I also went out that night because it was Friday. I wanted to hang out. and I ate, a ice cream sundae. There's your 2,000 calories right there. So all that work that you put in all week and being in that deficit, you just consumed all of that in 5 minutes. So it's one of those things that it's like an example is the best way to explain the phenomenon. I mean, it's one of those, it just makes sense if you look at the numbers. Like, you can be in this deficit all week, but that's why they tell you, you can't out train a bad diet. So it's like, you can train as hard as you want all week, but when you get to that weekend, you could blow all of that just on eating, poorly. And so that's why it takes so long, because it takes so long to consistently stay in a deficit, that if you could blow that in one day, though, or really in an hour, and then now it's going to take you that week just to get back to where you are. So that's why when people kind of they're consistent for even 5-6 weeks, and then they take a week or two off, you almost go back to where you were, because you lose so much out of that deficit.
Does anybody else that is on the Zoom platform want to ask a question or curious about anything? Okay, so Dr. Bowles, I have another question.
Sure.
Speaking of one of the students, younger kids that is a point guard, but he's very, very short. He keeps talking about wanting to grow. I was curious to know, is there any like training or aspects that can contribute to a growth spurt? Or is that just reliant on genetics?
Yeah,
I know that sometimes people say deadlifts, dead hangs, allows your body to stretch more.
I've kind of heard that, but I honestly don't know what the evidence is behind that. And even if it did, I don't think it would be significant enough to, like, if you're like that short to the point where you like need multiple inches, like, it's not going to give you multiple inches, right? So something like that, I would have to look into what the evidence shows. I'm not 100% sure, but to my understanding, there's nothing that significantly in terms of training that you can do to increase your height. That person, I would tell them, you need to be able to compensate for that, by being more powerful. So now it's like, say he's a point guard, he makes a move, he gets to the rim, he needs to be able to elevate a little higher than some of those other people. He needs to be able to absorb body contact, a lot better than someone that would be taller than him, to be able to compensate for the height difference. But yeah, just hanging from the bar is not, I don't think that's gonna get it done, in terms of the height thing.
Another question I had was, what is the best way to avoid Charlie horse or cramps? I feel like sometimes, although I'm not as active I used to be, I'll go to make a movement, I feel like a Charlie horse is about to occur. Where does that come from, and can you avoid them?
So that's like, it's really like a muscle cramp. So like you may not have it. That's usually from not stretching, or it can also be from poor nutrition. So like if some of your micronutrients are low, like your potassium, that's one. That's why you always hear people say they want to eat a banana. That's also because bananas have a good amount of carbohydrates. And so that those carbs can fuel you for a workout, but that potassium also helps prevent like muscle cramps and stuff like that as well. So I would really look into how your nutrition is and how you're preparing before those exercises. Because if those muscles are very tight and taut and you're trying to perform these like very quick movements, then you can imagine when you're basically, like we talked about with the concentric and eccentric, you're changing the length of that muscle. So if that flexibility is not there, then you're trying to change the length of that muscle too fast. And a lot of times that leads to, that type of sensation where you feel like a Charlie horse, or even whenever you've been going really hard, you may go really hard for like 2-3 minutes and feel like you're starting to kind of cramp up. And that sensation or that burning feel is also lactic acid building up that we talked about earlier.
Okay.
Yeah. So all of that is just, it's two things. The conditioning, as you get more conditioned, it's just like say you haven't worked out in a month and then you go and you do a really hardcore training session, you're going to be so sore that next day, and even more sore the day after that and the day after that. But say you've been working out consistently for a month, you do that same workout, your body's already conditioned to that. You know, you've already kind of raised your, like we mentioned before, that anaerobic threshold, that point to where we start to feel that burn and that lactic acid buildup. We've increased that through our training over the course of that month.
Mm-hmm. Okay. I had another question. You spoke earlier about the heart rate, and I was curious to know, LaMarcus Aldridge has an irregular heartbeat, so he had to retire.
Mm-hmm.
When you are monitoring your heart rate and you feel like a certain type of pain or discomfort in your chest, is that a connection to a irregular heartbeat? Is that something we should be aware of?
Not really. I mean, if you have a history of irregular heartbeats and you start to feel anything weird in your chest, then definitely stop immediately. But if you don't have any premorbid conditions in regards to your heart, and you just start to kind of feel some like kind of tightness, or that could really be because you're just in one of those like zone. Like, remember we talked about the different zones. You're probably like in a zone 5. You're probably, more than 90% above your maximum heart rate. And your breathing is probably a lot more deeper and heavy. You're using a lot of those like intercostal, like the rib muscles, and a lot of those accessory muscles to breathe. And so you're really tiring out. And so what you're feeling is oftentimes fatigue in the chest wall from that.
Okay. And another thing which I experienced when I was training, taking supplements without knowing what the supplements do. Can you explain the difference between regular caffeine pills and caffeine ephedra? Because I happened to mix 2 different caffeine ephedra, I believe it's pronounced, and felt like I was having like a heart attack or a fast heartbeat.
Some of those, and I'll let the nutritionist touch on that, next week. But some of those, like, was it like a pre-workout type of thing?
Yeah, it was like one of those supplement pills that had a lot of things in it, so I didn't know that you couldn't mix certain ingredients when you're taking caffeine ephedra.
What you're feeling is, I think that has niacin in it.
Mm-hmm.
And so niacin is one of those substances that can cause you to have that where you feel really flushed, you're kind of like red, you feel really hot. Sometimes it can cause you to like itch. A lot of times they put that in some of those caffeine pills or some of those, pills that you kind of take before you work out to kind of like, amp you up a little bit, and kind of give you that push. So a lot of those things do have niacin. I would look on the back and see if there's niacin in there, and that's probably why you feel that.
Okay.
But in terms of the differences between those 2 specific types of caffeine or components that are in the caffeine drink that you had or the pill, I'm not 100% sure. I would probably defer that to the nutritionist next week.
Okay. And my final question is, when you're used to training with free weights, and you try to go resistance bands, I've experienced like straining a muscle when I try to go from one to the other. You know what the connection is in that?
Probably technique and form. With the resistance. So the whole point of the resistance band is really trying to maintain that tension while you're concentrically contracting and eccentrically contracting. So for instance, if I'm curling with a band, like, you want to go very slow movements, because as I'm trying to curl up, that band is trying to pull me back down, right? And as I'm trying to lower the weight or lower the band down, it's still trying to pull me down. So focusing on slow controlled movements can typically prevent any type of like strain. And honestly, in terms of safety, resistant bands are really better because they use resistant bands for rehabilitation. Like, a lot of times when you see people getting rehab for whatever it is, there's not a lot of like, especially for like shoulder issues and, any type of like shoulder girdle or even lower extremity issues, they use a lot of resistant bands for rehab. So it's like, it kind of makes sense. Like, if I want to prevent injuries, to use a rehab modality to actually train with. And so that's kind of how I started using resistant bands. And then also like the pandemic, because it's like you couldn't go to a gym. And so I like went to one of our rehab gyms and like got a bunch of those resistant bands and started using those, because I was like, you know, it doesn't make sense for me to order all these dumbbells and all this stuff when I can just use something that we already train. Like when you're rehabbing, you're increasing the strength, you're increasing the mobility at that joint, you're increasing your function, right? So that's the same thing you do when you train with free weights. So that's kind of, you know, why I made that switch. And usually I feel like a better stretch. It's like a good feeling because it's not like that burn that you oftentimes feel with heavy weights. And then when you start doing that, your form starts getting off because it's free weight. So the weight can go into different planes. When you're doing resistant bands, it's going to stay in whatever plane that you're in, right? Like and so I think that with what you're experiencing is probably secondary to trying to move the force of the weight or the resistant band the same way you would move if you were using a dumbbell.
Mm-hmm.
And you really want to focus on slow controlled movements, really whether you use dumbbells or resistant bands. But like we mentioned before, there's more explosive movements that you can do as well with like kettlebells or say someone's training like more football stuff. They do a lot of hang cleans and snatches and stuff where you're performing these really like forceful movements very quickly. That's more so to build power. But if you're not necessarily trying to do that, if you're just trying to increase your overall strength, you know, shred, get more tone, then you don't need to really focus on those like fast, like, you know, forceful movements, you know, just slow controlled movements through the weight, focusing on pausing and breathing at the top and really squeezing and really putting emphasis on targeting whatever muscle you're trying to target is really the best type of technique to use to really prevent injuries.
Okay. Well, thank you for the information. I want to thank you for your time. Thank you for the presentation. If you can, could you forward me a copy of the presentation and I will email it to everybody that has joined the call so at least they have the presentation to revert back to?
Sure.
All right. And Swag Network, Swag Initiative, Swag Affiliates, thank you. We appreciate you taking your time on Saturday to come out and see these great content that we have for you. Next week, we will be back at 1 o'clock with nutritionist Mahalia French, and she will talk about the best ways to eat to have a better athletic performance. So thank you all for coming. God bless you and enjoy the rest of your day.